Assalamualaikum. We are from group team ZFA. My name is Muhammad Faris Iqbal Zahari. We will discussing case 9, ethical dilemmas in biomedical engineering. First question, what are the ethical concerns in this case? First, patient safety. The most paramount concern is the potential harm and even death of patients due to the 5% failure rate of the pacemaker. Releasing a device known to have such a risk without informing user directly violates the fundamental ethical obligation to prioritize patient safety and well-being. Second, deception and lack of informed consent. The company's decision to withhold vital information prevents doctors and patients from making informed healthcare decisions, violating ethical standards of transparency. Last, professional responsibility. The biomedical engineer has a professional responsibility to uphold ethical standards and protect the public. Their silence will make them complicit in the company's unethical behavior.
Assalamualaikum. My name is Muhammad Arif and I will continue to question 2, which is how does the principle of patient safety apply to engineering ethics? For the first point is prioritize safety in design and development. Safety should be primary consideration throughout the entire life cycle of medical device, from initial concept and design to manufacturing, testing and post-market surveillance. For the second point, which is advocacy for patient well-being. When forced with situational where patient safety is compromised, engineers have an ethical duty to advocate for well-being of patient, even if it means challenging their employers or organizational decision. And last one, which is transparency and disclosure. Engineers have responsibility to be transparent about the potential risks and limitation of their device. This information is crucial for informed decision making by healthcare professional and patient. For question 3, what should the engineer do if the company refuses to act ethically? Firstly is seeking external support. Report to relevant professional body, regulatory authority or whistleblower protection program might be necessary. The second point would be document finding. It is crucial for the engineers to meticulously document all communication, finding and action taken. This documentation can be vital if they choose to pursue legal or external report option. And lastly is consult legal and ethical expert. Understanding the potential consequence and gaining advice from the trusted professional can help navigate the situation.
Assalamualaikum warahmatullahi wabarakatuh. I am Muhammad Zaim Zikri Nasri. I will continue for the fourth question, for the question 4. For the question 4, how could transparency in medical engineering benefit society? For the first point, enhance patient safety. Openly communicating potential risks and limitation of medicals allow limitation patient and healthcare healthcare provider to make informed decision, leading to safer and more appropriate use of technology. For the second point, increase trust. Transparency builds trust between patient, healthcare professional, medical device companies, and regulator bodies. This trust is essential for the acceptance and effective implementation of medical innovation. And the last point, informed decision making. Transparency allows doctors and patients to fully understand the potential risks and benefit of medical device, enabling them to make more accurate, safe, and personalized treatment decision based on reliable information. Next, for the questions 5, which is discuss how regulatory bodies oversee ethical medical device development. For the first point, ethical standard. Regulatory bodies enforce ethical guidelines requiring companies to prioritize patient safely, proof device effectiveness through testing, and provide clear, accurate information for informed consent. The second is approval process. Agencies like the FDA require rigorous testing and clinical trial to ensure new medical devices are safe, effective, and have benefits that outweigh risk. And the last point is informed action. A regulator can enforce action like warning, fines, recalls of prosecution against companies that violate regulation or endanger public health. And this is our side source for our discussion. And that's all for us. Thank you.